Hello, my name is Josh Polidor, and today I will be conducting a physical examination. Here we have SM. She's pretty much is going to be my patient. Do you allow me to record?
Yes.
Do you allow me to touch you?
Yes.
Okay, so now we will conduct the exam. Prior to the exam, I want to make sure do you know this? Patient does have black nails on her hands and on her foot. That will be hard to conduct capillary refill. So I'll tell you right now, capillary refill is less than 3 seconds, which is good. More further on, patient does state that she has abdominal pain. We're gonna assess that to figure that out. And also, patient does have psoriasis. All right. So we're gonna start with that. We're gonna start with sanitizing our hand. We washed our hands already. Did vital signs. Did everything so far. Did the interview. So now I'm gonna inspect the head. So far, the head does look normal cephalic. Upon inspection, upon palpation, do you feel any pain?
No.
Okay, patient verbalized no pain. Patient hair, no signs of masses or bruises or any pulsations or any bumps. Okay, so far patient hair is her hair is equally distributed. Further on, she does have cranium is normal, no signs of any pain. Patient does have psoriasis, plaque psoriasis on her scalp so far, but other than that, there's no other lesions that was seen. Now I'm gonna go down to her head. I'm gonna feel her frontal sinuses, and then I'm gonna assess her maxillary sinuses. So far, everything looks symmetrical on her head as well. As I'm going down, so far it looks symmetrical. Temperature upon touch is warm. No signs of any cold temperature. No signs. Do you feel any pain?
No.
No pain. So now I'm gonna conduct the frontal sinuses. Any pain here?
No.
Okay. Any pain in the maxillary sinuses?
No.
Okay. You feel my hand?
Yes.
Good, good, good. So frontal sinuses and maxillary sinuses are clear. Now I'm gonna go and assess her eyes. So far I'm looking at inspecting her eyes. And no bruises or abrasion, no cytosis. That is upon her eyes. Her eyelids are good. Let me see. Gonna press down on conjunctives. Is pink. Mucous membrane is normal, wet, not dry. Sclera is pearly white. Moving forward, the inside of her irids are good as well. No signs of any lesion, no bruises or abrasion. So now I'm going to pretty much do tests on the eye. So the first cranial nerve I'm going to be assessing is cranial nerve number 2, which is optic. All right. Ready?
Yes.
All right. All right. Patient pupils are briskly constricted to 3, which is good, 3 mm. All right. Follow my pen. Only use your eyes, not your head. Assessing for the 6 cardinal gazes. Okay. Cover one eye. How many hands am I holding? How many fingers am I holding?
5, 2,
Okay, cover the other eye.
3, 2.
Confrontation test is good, positive. Okay, so far we're looking good. Gonna look at the eyes. Okay, extraocular. Cranial nerve number 3, extraocular was intact. Cranial nerve number 4, which is triocular, was intact. Cranial nerve number 6, abducens, is also intact. So there's no excessive discharge or any polyps within her eyes. So far, cranial nerves 2, 3, 4, and 6 are all intact. Okay? So now, going down to the nose. Inspecting the nose, nasal septum is midline, not deviated, no signs of any polyps, no nasal polyps, no bruises, lesions, or excessive drainage, no abnormal drainage. Okay, close your eyes. Occlude one nose. Blow. Okay, blow on the other one. Okay, nose is patent from anything that's blocking it. Close your eyes again. Occlude one nose. Smell. What does it smell like?
Alcohol.
Okay, occlude the other nose there. What does it smell like?
Alcohol.
Okay, cranial nerve number 1, olfactory, is intact. Moving down. Moving forward, I'm going to pretty much go to the mouth. Say ah for me.
Ah.
Okay, soft palate, hard palate is visible. No signs of any abnormal lesions, abrasions, or bumps or masses. Say ah. Okay, tongue, move your tongue left and right for me. Move it up, move it down. No signs of any neurological deficits. Teeth, there are no dental caries. Fully brushed. Breath does not. There's no halitosis breath or a mild odorous breath. Moving forward, her tonsils are not visible, which is a good thing because it's no inflammation. Furthermore, the buccal mucosa, open eye, is pink. Mucous membranes are pink. No signs of any swelling in the back. Okay, swallow for me. All right, so cranial nerve number 10, vagus, is checked. Cranial nerve number 12, hypoglossal, is checked. Cranial nerve number 9, glossopharyngeal, is checked, which is all good. All right, now I'm gonna feel for her the TMG, which is temporomandibular joint. All right, clutch your jaw for me. I feel the masseter muscles, which is good. Move your side to side, good. Put it down. Press down to your chin, good. Clench again, good. All right. So temporomandibular, no clicks or joints, or the temporomandibular joint, there is no clicks or there's no deformity of her joint. So moving forward, now I'm gonna move over to her ear. Okay, checking the tragus. Any pain?
No.
Okay, good. Her auricle is well aligned, no deviation or any droopiness, no excess cerumen. Now I'm checking the other ear. Okay, auditory meatus is clear, no blockage. Any pain?
No.
Any pain?
No.
Okay, so there's no pain to her tragus. Auricle is well aligned, symmetrical within her face, aligned with her face, which is good. Moving forward, I'm going now to pretty much going to apply resistance to her face, and I'm also going to do a little other tests, all right? But prior to that, occlude one ear. I'm going to do the whisper test to assess for vestibular cochlear cranial nerve number 8.
3, 2, 1. Jump, run, jump.
Okay, so patient has no neurological deficits in her ear. She does present with positive reassurance of the test of the cranial nerve number 8. She does hear, so which is good. Now I'm going to apply. Close your eyes. Do you feel this?
Yes.
What does it feel like?
Soft.
Good. You feel this?
Yes.
Okay. What does it feel like?
Rough.
Good, good. So cranial nerve number 5, which is trigeminal, is intact. Puff your face for me. Smile. Frown. Move your eyebrows. Okay. Any pain with that?
No.
Okay. Try. Now I'm gonna move. Press resistance on your eyebrows. Try still putting it up. Good. Okay. So cranial nerve number 7, which is facial expression, is intact. So far, we assessed the cranial nerve 1, 2, 3, 4, 5, 6, 7, 8, 9, 11, no, 9, 10, and 12. So now we're gonna do the spinal accessory. I'm gonna press down. You apply. As I'm applying resistance, you try to shrug your shoulders. Okay. Put your arms out for me. I'm gonna do it again. Okay. Bend your neck back to me. Okay. I'm gonna apply pressure again. All right. Spinal accessory number 11, cranial nerve number 11 is intact. All right. So that's good. Now we're gonna move down to the neck. See the neck. Inspecting the skin. Skin is clear. No signs of any lesions. No psoriasis noted on any parts of her body except the scalp for now. Moving forward. Trachea is midline. No issues with that. Let me see. All right. I'm gonna palpate for any lymph nodes. Start with her occipital. Stand up for me so I can show the camera. Turn around. So because she has a lot of hair, occipital is right beneath. Turn around. You can see right beneath, right here. Okay. Submental. Okay, I feel the lymph nodes a little bit. Very, very hard. Not hard, but very hard to touch in terms of finding. Very hard to find. Now I'm going to the submandibular. Okay. Okay. Lymph nodes in the neck. Open your arms for me. You're gonna find the epitrochlear lymph nodes. Found it. It's right inside. That's good. All right. The other one. All right. That's good. Turn around for me. Now I'm going to palpate for the thyroid. Okay. So now, as I'm moving the trachea midline towards my left, which is your right, I'm gonna push the trachea towards my left, which is your right. Swallow for me. Okay, which is good. Thyroid was felt upon her swallowing. I can feel her gag reflex is intact as well, moving up, which is good. So that's good so far. Now we're good to go with that. Now we're gonna start assessing the chest area. Inspection so far, the contour looks nice, warm to touch. Anterior posterior, stand up for me. Anterior posterior is 1 to 2, is not 1 to 1, which is barrel chest for people who have COPD or smokers. Moving forward, no signs of any abrasions or lesions or any pulsations or masses that are bounding. Now we're gonna listen for the lung sounds upon her chest. Okay, take a seat for me. Oh, you're fine. Start with the lung sounds. Go ahead, breathe in. Breathe out. Breathe in. Okay. Breathe out. Breathe in. Breathe out. Breathe in. There we go. Breathe out. Because she's a lady, what would make it easier is if she were to lift her breast, so you get a good hearing within the diaphragm of the stethoscope. But I'm not gonna ask her for this one. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. There we go. Breathe in. Breathe out. Okay, so far, anteriorly, her lung sounds were vesicular, no signs of any crackles, no signs of any tachypnea, bradyapnea, no signs of any shortness of breath. So far, the patient lung sounds are good. Respirations are within 12 to 20, which is very good, very good. Moving forward, I'm going to inspect her posterior lung sounds. Time for me. So the one thing we gotta keep in mind is the scapulas and the spine. You'll hear bronchovesicular within the spine area or anything that's blocking it. So you have to go inwards. Breathe in. Breathe out. 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 Breathe in. There we go. Breathe out. Breathe in. And breathe out for me. All right. Do me a favor. Turn around for me. Gonna assess the carotid artery. All right. +2. I'm gonna assess for any bruit with the bell. Good. Good. No signs of any bruit noted. Upon anterior and posterior, both sides lungs are clear. No signs, no sounds, no heard sounds of adventitious sounds heard. No crackles, no shortness of breath, no bradyapnea or tachypnea. Patient is well presented, symmetrical. I'm gonna now test for the coastal vertebral. Gonna test for pretty much tenderness. Any tenderness? Pain?
No.
Any tenderness, pain?
No.
Okay. Now I'm gonna also assess the coastal vertebral as she inspirate and expirate. Go ahead and breathe for me. One more time. Okay, so shoulders are symmetrically when she inspirate and expirate, moving forward. There's no abrasions or bruises on her back, so that is also good. You can take a seat for me. All right. Better yet, now I'm gonna listen to your heart. We're gonna go to the bed. Go ahead. Just lay down. That's fine. There we go. So now what I'm going to be doing is assessing her neck for JVD, jugular vein distension. It's 30-45 degree of the bed that has to be brought down, and then she has to turn her head left or right. All right, turn left for me. All right, no signs of any jugular vein distension. Other side. No sign of any jugular vein distension there. Now I'm going to listen to her heart sounds. Better yet, come. I want the camera to see. So we're going to start with listening to her heart sounds. Animatically, we're going to go to the second intercostal space where there's two heart valves to listen to, which is the aortic and pulmonic. So right on the midline. All right. S1, S2 noted in the aortic valve. Now to the pulmonic, second intercostal. S1, S2 noted. Now again, for the ladies, you would want her to lift her breast to get a good hearing, a good sound. Go ahead and lift your breast for me. Third intercostal space, which is the Erb's point. Okay. Now for the tricuspid. You can put it down for me. Let's see if I can hear it. Okay, S1, S2 noted. Now for the fifth valve, which is the mitral valve. Lift your breast for me. You would want them you want to ask them to lift their breasts if they're females. For some females, if they don't have bigger breasts, then it's easier. If they have smaller breasts, you can hear it. But again, all right. So mitral valve is within the fifth intercostal mid-clavicular line. Moving forward, patient. S1, S2 noted. No sounds of any gallop so far heard upon inspection. Now I'm going to inspect for bruits. All right. Before I auscultate, I'm inspecting for any. If her shirt was off, we would be inspecting for any aortic pulsations, and then you'll palpate for any thrills as well. So that's important to know. All right. No signs of abnormal thrill or pulsations. Now with the bell, we're gonna assess for any bruits or abnormalities in the heart. Okay. Now for the second intercostal. No signs of no heard abnormalities. Now we go down to the Erb's point. Lift your breast for me. Thank you. Okay, now for the tricuspid in the fourth, fifth intercostal. Put it down. Now for the mitral valve, also known as the PMI. No abnormalities heard. I do feel and see and hear the PMI, which is the post-maximal impulse. It is fifth intercostal mid-clavicular line. Patient does not present with any abnormalities. Again, heart sounds are normal, sounds normal sinus rhythm. Apical pulse was counted upon doing the apical pulse. We did it at 30 seconds. It's always good. It's always imperative to do 1 full minute. It was between 76 to 78 beats per minute, which is good. All right. Now we're going to inspect the stomach. for this, I would have her lay flat, which is important to hear the bowel sounds because she did say she had some pain. So we want you to lay down. All right. See? Lay down. I'm gonna start with I'm gonna pretty much inspect the contour of the stomach. It is well rounded. Patient presented with a little abdominal distension. Other than that, we're gonna pretty much check our patient. And now it's time to auscultate. You always gotta inspect and then auscultate to not get false bowel sounds. Start with the right upper quadrant. Bowel sounds are noted. Now for the right lower quadrant. Bowel sounds is noted. Left upper quadrant. Bowel sounds is noted. Now for the left lower quadrant. Any pain?
Yeah.
Patient verbalized pain in the lower quadrant upon my stethoscope bell being put on. No bowel sounds noted. Absent bowels within the lower left quadrant. Now we're going to pretty much palpate. I'm going to do zigzags in each quadrant, pretty much percussing. No abdominal fluid-like wave filling. She does feel the percussion when I percuss the lower left quadrant. There's no wave-like abdominal pain. I'm going to inspect for a bruit. Changing the bell. No signs of any bruit. Not bruit, I apologize. We're going to assess for any vascular sounds, which is because the aorta is midline. Umbilicus is also midline. No vascular sounds heard, which is good. All right. Did you eat today?
No.
When's the last time you used the bathroom?
Last night.
Last night. So patient verbalized using the bathroom last night or the morning of last night?
Yesterday afternoon.
Yesterday afternoon? Okay, good. So now, what we're going to do now, stand up for me. Come on. We're going to have the patient sit. Let's sit for me. Going to assess for tactile firmness. Go ahead. Every time I move my hand, both of my hands, you say 99, all right?
Okay.
Go ahead.
99.
Okay. Let me do some light palpation on your stomach. Almost forgot, so they can see. Oh, okay. Okay, small grimacing as I'm palpating the lower quadrant, light palpating. All right. Now I'm gonna feel for her pulses. Temporal pulse is felt. Carotid artery was done one at a time earlier, but I'll do it again. +2, no bounding for both areas. Now your brachial, stand up for me. See your brachial arteries. Present, +2. Now for the radial. Also present, +2. Sit down for me. We're gonna assess the popliteal. Popliteal present, +2. No bounding or weaknesses. Now we're gonna assess now we're gonna do the dorsalis pedis. Dorsalis pedis. I want you to see it. Dorsalis pedis, okay. Now posterior tibialis. All right, +2. All right, so now while I'm down there, I'm gonna apply resistance to your ankle. Try to push me up. All right, that's good. Show you. Now push down. Okay. Now do internal eversion and inversion with your legs. You gotta not touch it. There we go. Good. Now move it around. All right, that's good. Skin is normal, no signs of any edema. Hair distribution is symmetrical upon skin assessment. So far, we're looking good. I'm gonna inspect for capillary refills. Toes, any pain?
No.
Okay, any pain?
No.
Okay, that's good, that's good, that's good. Stand up for me. Stand up for me. You're gonna bend down. You're gonna assess the spinal curvature. No signs of any pain?
No.
Any abnormalities when I'm touching it?
No.
Okay, so that's good. That's good, that's good, that's good. So now everything I do, you follow me. You're gonna hyperextend, extension with your shoulder. Extension, both. Hyperextension, good. Abduction, adduction, internal rotation. Internal, external, sorry, both arms. Good, good, good. Pronation, supination, flexion, extension. Good, good. No neurological deficits noted upon having her follow me, which is a good sign. All right. So now we're going to do the same thing. Put your feet out. Put it down. Flex it. All right. Come forward for me so they can see. Flexing, which is good. That's good. That's good. Now take a seat. Bend your knee. Bend your knee. This one. Bring it up. Bend it. I'm gonna apply resistance, push it. All right. Push it that back. All right. Same thing. Good. Now flex your knee. All right. Get back up. Squat a bit. Good. Get back up. That's good. That's good. Walk for me. Walk back. Walk and then turn around. All right, that's good. Now tippy toes, so they can see it. Okay, good. Now walk on your heels. Okay, so that's good. That's good. That's good. That's good. Now we're going to pretty much stand straight. Close your eyes. We're doing the Romberg's test to see if patient sways in any type of form. Put your feet together.
You said close my eyes?
Yeah, put your feet together and close your eyes. Good. No signs of any swing. Open your eyes. Okay, take a seat. Take a seat. All right, you're gonna pull my arms as I'm pulling back. Good, now other way. Okay, now put your arms like this. We're gonna flex. As I prevent you from flexing, keep trying to flex. Good. Now push back as you're trying to extend. Good, 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 good. Let me see your fingers. All right. Patient's skin is warm upon touch. Skin turgor is good. No pitting edema or edema. It's warm upon touch. Capillary refills are less than 3. Any pain in your joints? No. Okay. Now we're gonna assess the patella. Okay. Reflex is intact in the right knee. Reflex is intact in the left knee. Okay. All right. Close your eyes. You feel this?
Yes.
How does it feel like?
Soft.
Soft? That's good. How did this feel like?
Sharp.
Sharp? Dull? Okay, sharp and dull. Patient superficial pain is intact. Light sensation, let's see. You feel that?
Yes.
All right, light sensation is also intact. Moving forward, we're going to test the sterogenous test. Close your eyes. Tell me what's in your hand.
Cotton.
Okay, that's good, that's good. Close it. You can stop now. Tell me what's in this hand.
A stick.
Okay, good, good, good. Sterogenous test is intact. Let me see your hands. Close your eyes. What do you feel? What do you feel? What am I touching?
My index finger.
Which side?
This is my right.
All right. What about this?
My thumb. On my
Which
left
side?
side.
Left side. Okay. So now patient is intact as far as positioning. All right. Lastly, what we're going to assess is rapid moving. So you're going to do this every time. All right. And go faster as you do it. Keep going. Okay, so now that's good. That's good. That's good. That's good. All right. So today we will conclude the physical examination. I want to thank Sarah for assisting me and helping me as I did this. Thank you for all that is watching, and I hope to do another physical examination in the future. Thank you.